My dear subscriber and viewers, welcome back to Akshara Akshita 2023 channel. In this video, I am going to explain about 2023 CPT evaluation and management of coding changes and guidelines. So in 2023, there are huge changes in the evaluation management E&M sections. So I am going to explain detailedly how to take a level and place of service, everything I am going to explain detailedly part by part. So those who are not subscribed my channels, please subscribe my channels and press the bell button, select all, then only you will get my future videos as a notifications. Okay guys, let's start from the first point. Actually E&M 2023 CPT E&M evaluation, there are a lot of changes actually. This E&M, the following categories in the place of service is applicable, like office visit, outpatient, hospital inpatient, observation services, consultation, emergency, nursing facility, home or residence, then prolonged service, then so many place of service will be there for E&M. So doctor has to mention everything in the medical report. Okay, then in 2023, 99211 and 99281 face-to-face service may be performed by only clinical staff. So doctor will not involve in this, doctor only supervision, or so doctor will not involve directly to perform this level, first level. So to perform this level, clinical staff is enough to code first level. So 99211 and 99281 MDM not required and time also not required. If clinical staff evaluation done, then we can consider first level of outpatient and first level of emergency department. Okay, first let's see definition of type of the patient. What is the new patient? What is the established patient? What is this initial, subsequent, like this type of the patient we need to know before arriving the place of service and before arriving the CPT code. Okay, what is the new patient? New patient means the one who has not received any professional services from the physician or other qualified healthcare professional exact same specialty and subspecialty who belongs to same group of practice within past 3 years. Those who are not received these services within same specialty or subspecialty, those who are not received this service within past 3 years, those patient considered as new patient. Okay, what is the established patient? Established patient means the patient who has received professional services from the physician within same specialty or subspecialty within the past 3 years, those are considered as established patient. For an example, the patient is coming to the ENT department first year. Within that year, again next month, patient is going same ENT department. Okay, so second time onwards, patient will be established to that specialty. Okay, so within same specialty or subspecialty within the 3 years, patient is coming to that hospital. Those patient called as established patient. Okay, for new patient example, patient coming to the dermatology department 2021, and in same 2021 same hospital, patient coming to hospital for cardiology department same year. Then cardiology department, that encounter patient will be new only. We should not consider established patient because specialty is different. Same hospital only, but specialty is different. So same year dermatology patient is already performed, then same year after that cardiology patient is going. So cardiology department patient is new patient only. We should not consider patient is coming to second time to that hospital, so patient will be established means no, patient will be new patient only, because we have to check whether it is same specialty or subspecialty within that group means within that hospital. So within these 3 years, same specialty means or subspecialty means then it is established. Those who are not received professional services from the physicians within same specialty or subspecialty within the past 3 years means those patient are new patient. Okay, hope you understand. Then these new patient, established patients will come for outpatient services. Okay, then if it is inpatient services, patient types will be initial services or subsequent services. What is the initial services? Initial services, when the patient has not received any professional services from physician and or another physician or other qualified healthcare professional of the exact same specialty or subspecialty who belongs to same group of practice during the inpatient or observation nursing facility admission and stay. So initial services means first day. The short definition is first day of admission is initial services. Other than first day, until discharge, before the discharge, patient will be subsequent. So subsequent means from the second day to until the discharge, before the discharge date, patient will be considered as subsequent services. So first day of the admission is initial. Other than first day of services until the discharge day is considered as subsequent services. When E&M service time, what are all the other services included? Other services we can bill separately. Let's see that points separately. So any specifically identifiable procedure or service performed on date of E&M service may be reported separately. Okay, so whatever service performed separately with the E&M service, we can bill separately those services with E&M service. Okay, then the ordering and actual performance and or interpretation of diagnosis test studies during the patient encounter are not included in determination of level of E&M services. When the professional interpretation of those tests or studies is reported separately by physician or other qualified healthcare professional reporting the E&M services. So whenever if you have some set of CPT code, professional service separately CPT code, and we build those tests separately, means those services we cannot include in the E&M service countable elements. Okay. Then performance of diagnostic test for which specific CPT codes are available may be reported separately in addition to the appropriate E&M service code. Okay, so whenever diagnostic test or studies test, we have CPT code separately. So those CPTs we can bill separately with the E&M services. Then the interpretation of result of diagnostic test or studies, example professional component, which preparation of separate distinct identifiable signed returned report may also be reported separately using appropriate CPT code with 26 modifier if applicable with the E&M services. Okay, so interpretation of result of diagnostics test CPT code, that preparation of separately distinct from the E&M services. So those services we can bill separately with the E&M services with appropriate modifier. Okay, then the extent of history and physical examination is not an element in selection of level of the E&M service code. So in 2023, the main update is history and examination no need to consider in the MDM level. Okay, so totally they have removed from the removed from the ENM elements history and physical examinations. So history and physical examination is not an element in the selection of level of these ENM service codes. So 2023, so based on only MDM and time based levels. In 2023, the level of MDM is defined as each services like total time of the ENM service performed on the date of the encounter and MDM. These two elements only we need to consider the final level of the ENM service. Then so which within each category or subcategory of ENM service based on the MDM or time, there are 3 to 5 level of the ENM service available. Okay, so level of service are not interchangeable among the different category or subcategory of services. So let's see guidelines for selecting level of the based on the MDM. So let's see the step by step how we can select the levels of the ENM services based on the MDM. So there are 4 types of MDM are recognized. One is straightforward, next is low complexity, then moderate complexity, then high complexity. These are the final types of the MDM levels. Okay, so how we can select the final straightforward, low complexity, moderate? So based on the 3 elements only we need to conclude the whether it is straightforward MDM or low complexity, moderate or high complexity MDM. Okay, in 2023 concept of level of the MDM does not apply to the level 1 outpatient established patient level 1 99211 99281. Okay, so if first level no need to involve, not mandatory to involve the physician involvement. If other than physician like healthcare assessment staff like nurse or any other than physician staff involvement, they examined the patient, then we can consider first level. If the physician involvement meant from second level to 4 level, we need to choose. Okay, so for selection of first level of the outpatient established ENM CPT code and emergency first level, so no need to involve the doctor. If other than physician involvement is enough to selection of first level of the CPT code. So in 2023 MDM is defined by 3 elements. Okay, so those elements are the 2 of the, if within the 3 element, out of the 3 element 2 elements of the MDM must be meet. Okay, then only we can go with the either it is straightforward, low, moderate or high complexity. So out of these 3 elements, 2 elements should match. Okay, then what are those 3 elements? First element is problem, number and complexity of the problem addressed. Second element is data, amount and or complexity of data to be reviewed and analyzed. Third element is risk of complication and or morbidity or mortality of patient management. Based on 3 elements only, we need to finalize the final category of the MDM table. Okay, the final categories are straightforward, low, moderate, high. So based on these 3 elements only, that final table we have to choose it. So in this video I am going to explain about only problem. So number and complexity of problem addressed only we are going to see in this video. Okay, so in this now first level problem is divided into 4 levels. One is minimal, low, moderate, high. So each elements each elements there are four types of categories. One is minimal, low, moderate, high. So within this four we need to choose one based on the our medical report. What is the what it will be matching to that particular category, we need to select from the our medical report. Okay, so let's see detailedly each category. What will be the minimal? What if medical report? What should be there to consider as minimal? So like that, each category minimal, low, moderate, high. Let's see detailedly. If minimal means self-limited or minor problem, that will be considered as minimal. Low means two or more self-limited or minor problems, one stable chronic illness or acute stable illness, or one acute uncomplicated illness or injury, or one acute uncomplicated illness or injury requiring hospital inpatient or observation level of care. For moderate means actually within this 3 point low level, how many points are there? 1, 2, 3, 4, 5 are there. Within this 5 point, only one should match. No need to match everything, all point. If any one of the point is matching, then we can consider it as a low level. Like that, all levels, any one point it should match to consider as particular levels. Okay, for moderate, one or more chronic illness with exacerbation, progressions or side effect of the treatment, or two or more stable chronic illness or uncomplicated requiring hospital inpatient observation care, one acute undiagnosed new problem with uncertain progress, then one acute illness with systemic problems. If for a high level, one or more chronic illness with a severe exacerbation, progression or side effect of the treatment, or one acute or chronic illness injury that poses a threat to life or bodily function. Any of one element should match to consider as high level. So let's see what is the meaning of self-limited, what is the meaning of acute, what is the meaning of stable chronic illness. So if you know the meaning of this point terms, then only you can choose from your medical record. Okay, so if you don't know what is the meaning of self-limited, then how you will select from the medical report what will be the low level or moderate level, high level, then how you will select it? You should know this point meaning. What is the acute illness, what is the systemic symptoms, what is the undiagnosed or new problems. So those meanings let's see separately, each point's meaning let's see separately. Okay, the first is you should know what is the problem. The problem is disease and condition, illness or injury or symptoms or signs or any findings or any complaint. These are considered as problem. That problem either doctor is addressed or not, we should know. These problem tables, all problems we should doctor should addressed or managed, then only that problems we can count as in the element. Okay, so what is the meaning of problem addressed? So I told you what those whatever the conditions is there in our medical report, those conditions, those problems doctor has to addressed, then only that problem we can consider in the level of the MDM. Okay, then only we can count in the level of the MDM table. So doctor should address the particular problem, then only the problem we can consider. So what is the meaning of problem addressed? The problem is the problem that problem addressed means doctor has to manage the problem, doctor has to evaluate that particular problem. or doctor has to check, doctor has to review that problem, or doctor has to order, or anything doctor needs to do towards that particular problem, then only that problem considered as problem addressed. Okay, doctor has to manage that problem then directly to that patient, then only we can consider that problem is addressed. Okay. Okay, let's see the first each point that self-limited. What is a self-limited or minor problem? A problem that runs defined and prescribed course is transient in nature, and it is not likely to permanently alter the health status. So it will not alter the health status. Any problem comes and it goes automatically. That is a self-limited or minor problem. What are the examples for self-limited? Any cough or cold or any insect bite. This condition, it will come and it goes automatically without any treatment also, it will resolve the automatically. So what are the conditions comes and resolving its own in nature, those conditions considered as self-limited or minor problem. Okay. Then what is the chronic illness? The word itself you can identify the meaning of the chronic illness. The problem with expected duration at least 1 year or until the death patient. So those conditions considered as chronic. The purpose of defined chronicity conditions are treated as chronic whether or not stage or severity changes. For example, uncontrolled diabetic and controlled diabetic, or single chronic condition only, but uncontrolled. The stable of purpose of the categorized MDM is defined as specific treatment goals for an individual patient. So for the controlled patient, patient is taking the medication. That chronic condition is not progressing, not developing and not reducing also. That problem is in the stable condition. Okay. So those conditions we can consider as stable chronic illness. So all condition, long-term condition considered as chronic conditions like diabetic, CKD, chronic heart disease, heart failure. So then if you know some set of conditions, then no problem. If you don't know what is the particular condition, whether it is acute or chronic condition, you can check in the Google also. Type any condition in the Google. In the right side you can find either that particular condition is the acute condition or chronic conditions. Okay, for CPC purpose, please make your list of the chronic conditions and remember that when MDM applying time. Okay, so you know now what is the chronic conditions, what is the meaning of the stable. Okay, next, the patient who is not is next is acute conditions. What is the acute conditions? Acute condition, any recent problem, any recently diagnosed conditions considered as acute, or any new problem that will be short-term problem with a low risk of morbidity, which is treatment is considered, that will be acute conditions. And there is a little to no risk mortality with the treatment and full recovery without function of impairment is expected. Okay. Then problem that is normally self-limited or minor problem is not resolving consistent with the definitive or prescribed course is an acute uncomplicated condition. Whatever the self-limited condition is not resolving its own, then we need to we need to address the problem properly by the physicians. Those conditions also we can consider as acute conditions. All short-term conditions, short-term problems should be as acute conditions. Okay. Then uncomplicated illness means, uncomplicated means there is no complication based due to that condition. There is no complication, there is no risk of the mortality That will be the uncomplicated meaning. Next, acute uncomplicated illness or injury requiring hospital inpatient or observation level of care. So recent or new or short term problem is the acute conditions we saw already. So with a low risk of mortality, which is treatment is the record. But this treatment records is the delivery in the hospital inpatient observation level settings. So without admission, this condition we cannot treat the problem by the physicians. So for those conditions, doctor must admit the patient, then only he can treat the problem. So those patient only we have to take as a one point, acute uncomplicated illness or injury requiring hospital inpatient or observation level of care. So any acute condition, any uncomplicated illness requiring hospital inpatient settings or observation level of settings, then that patient only this point will be suitable. Next, stable acute illness. So the problem that is new or recent for which treatment has been initiated and the patient is improved, and while resolution may not be complete, the stable with the respect to these conditions. So condition will not curable, but the condition is not improving also, the condition is not resolving also. So but the acute condition is unstable condition, equally stable conditions, not improving, not resolving also, stable with the treatment of prescribed medications. Those condition is stable acute illness. Next, chronic illness with exacerbation, progression or side effect of treatment. So all chronic conditions that acutely worsening or poorly controlled or progression with an intent to control the progressions or requiring additional supportive care. So requiring attention of the treatment for the side effect. These are the meaning of the acute illness with the exacerbation. Next, undiagnosed new problem with uncertain progress. What is the undiagnosed new problem? The problem in the differential diagnosis that represent condition likely to result in the high risk of morbidity without treatment. So without treatment, that patient will be high risk of morbidity patient. So the problem is undiagnosed. So doctor, we don't know what is the diagnosis. So the problem is undiagnosed situations with the certain progressions. So those conditions we can consider as a point in the MTM level, undiagnosed new problem with uncertain progressions. Okay. Next is acute illness with the systemic symptoms. So what all acute illness with the systemic symptoms we can consider. What is the systemic symptoms? Systemic symptoms means general symptoms like fever, body ache, fatigue, and these are we can consider systemic symptoms. Acute illness with the systemic symptoms means we can take as a one point. Okay. The next is acute complicated injury. Acute conditions, an injury which requires treatment that includes evaluation of body system that are not directly part of the injury or organ. Injury is extensive or treatment options are multiple associated with the risk of morbidity. So without risk of morbidity means uncomplicated. With the risk of morbidity means complicated injury. The patient will be complicated with acute condition. Okay. The next, chronic illness with a severe exacerbation progression. So as we saw already, all severe exacerbation progression of the chronic illness or severe side effect of the treatment that have significant risk of morbidity and may require escalation level of the care. So those points we can consider as chronic illness with severe exacerbations. Only exacerbation is another point. Severe exacerbations this point. Okay. Then acute chronic illness or injury that poses a threat to life. or bodily functions. Threat to life, you know the meaning, right? So all acute conditions, what are the acute conditions or what are the chronic conditions or threat to life or bodily function, those conditions we can consider as this point. Acute illness with systemic symptoms, acute complicated injury, chronic illness or injury with exacerbation, progressions or side effect of the treatment that poses threat to life or bodily functions in the near term without treatment. Okay, this is the meaning of this point. Okay, some symptoms may represent condition that is significant probably and poses potential threat to life or bodily functions. These may be included in the category when evaluation treatment is consistent with the degree of potential severity. Okay, that's all about the problem. So within the three element, first element we completed, problem. Okay, so problem means acute number and complexity of problem addressed finished. So within that and four category are there: minimal, low, moderate and high. So within this point, either self-limited or stable, chronic illness or acute, based on the conditions what category it falls under. So we need to choose from this table what is the level of the number and complexity of the problem addressed. So either it is minimal or high. So based on this point only we need to consider. So one element finished. Okay, if you have any doubt in this, please comment, and if you like this video, please like and share to your friends also, and don't forget to subscribe my channel. In the next video I am going to explain about data. So data means amount and complexity of data to be reviewed and analyzed. Okay, let's see in the next video, ENM part 2. And thanks for watching my video. Thank you so much. Bye bye.